Assalamu alaikum. My name is Zainab and today my topic of discussion is common skin problems present in a human body. So let's start. There is course outlines in which we will get through introduction, acne, pimples, scars, blisters, burns, cons and clauses, allergies and skin reactions, prevention and care tips. So one by one we will get through this and there will be a definition of this and causes and treatment, all other basic anomalies which will include in them. So let's start. First there is an introduction. So the skin is the largest organ of the body and it is a protective barrier. As we already know, there is a organ systems in a human body. So skin is the largest organ in the human body which acts as a protective layer because this is the outermost layer of the human body and it is a protective barrier. Various skin conditions can affect its health and appearance. As we already know, various environmental factors also affect the human body and skin overview of in this lecture we will get through overview of common skin conditions and their impact on daily life, importance of maintaining skin health for overall well-being, and common causes and risk factors for skin issues. So there is first of all acne. Acne, we already know this anomaly, this condition, this is the acne. So a chronic condition caused by closed hair follicle, excess oil, bacteria and dead skin cells. Mostly there are environmental factors which affect the skin, normal healthy skin, which cause acne. There will be a closed hair and hair follicle and excess oil. Excess oil may be most commonly in the summer. There is a bacteria and dead skin cells. When we never go through the proper skin care, then we can face the acne. Acne may be because of hormonal changes in which excessive oil production can occur, poor diet, stress, genetics and certain medications. So certain medications can cause acne and there are many types of acne. So first of all there is a whiteheads. Whiteheads are closed pores. Closed pores, the pores which are closed but are closed are called whiteheads. And there is blackheads in which deep open closed pores and papules, small red tender bumps, pustules, pimple with pus additive, nodules, large painful lumps and under the skin. And cystic acne, deep and pus-filled lumps. There are further types, mild, moderate and severe. So I have arranged another slides for special acne. In another lecture I will get through all their details. Okay, so what will be its treatment to treat acne? The over-the-counter treatment: benzoyl peroxide, salicylic acid and sulfur based product. These are all skincare products you can use in a daily life by prescription of the doctor. And there are certain retinoids, antibiotics, hormonal treatments. Life changes in which we can use moderate and high amount of water to maintain our skin healthy, diet modification and stress management. So these are all about acne. There is another reason pimple. We sometimes call acne and pimples in a daily life, but there is a differentiation. If there is a small pustules or papules, means there is inflammatory signs of the acne on a face, so this is called a pimples. So there will be a small pustules and papules formed due to closed pores and bacterial infection, and this is the pimples and they occur mostly on a face. There are same causes as discussed before for acne: hormonal imbalance, poor hygiene, excessive oil production and diet. So prevention: regular face washing and mild cleanser you have to use, and there is avoiding touching the face frequently and using non-comedogenic skincare products. Means the skincare products which you use for makeup makeover, they can damage your skin too, so prevent those products. So what will be the treatment? Treatment as discussed before: benzoyl peroxide, salicylic acid, tea tree oil, Home remedies, ice application, honey, aloe vera. Dermatological procedures, chemical peels and laser therapy. These are all about pimples. So next is the scars, which is the most important topic. You can say there are specific scar types which can be discussed and which can be discussed in a detailed. So I have arranged another slides for especially on the scars and types of scar, which I will make presentation in a next lecture. Okay. So there is a scars. Scars are areas of fibrous tissues that replace the normal skin after an injury. After an injury, after a burn, there will be a scar. There leave some scars which can make a mark on your body. These are the scars you can see. So types, there are atrophic scars, smaller scars you can say because of acne and after chickenpox or sunken scars are atrophic scars just like this. And there are hypertrophic scars. Hypertrophic scars are thick and raised and within their limit. Means to say, if there is a burn and there is a scar in a higher level and it is a thick and raised, so this is called hypertrophic scars. And there is a keloid scars just like hypertrophic, but they do not up to their limit because they cross their limit and reach to the other parts normal skin of the body. So there is a huge difference between hypertrophic scar and keloid scar you can say. So what will be its treatment? You can use vitamin E and aloe vera in a home remedies, medical treatment, laser therapy, microneedling, steroid injections and dermal fillers. And there is a prevention, treating acne and wound early, avoiding picking at the skin. You can't pick its skin because this can leave a scar on your body. So there are blisters. Blisters, as you well know, in Urdu we can say challa, and blisters are fluid-free field sacs that develop due to skin friction, burns, or infection. There are the causes of the blisters, and causes, as already mentioned, friction from shoes or repetitive movements, burn from heat or chemicals, infections such as herpes or chickenpox, and these are the scars. These are the blisters you can see. So do not pop blisters to avoid infection because this protect the skin from the act as a barrier for a skin from environmental factors. So do not pop the blisters. Keep the area clean and covered and use antiseptic ointments and protective bandages. And these are all about blisters. Okay. So there is a burns. Burn is also including in the common skin problems. Sometime there are first degree burn, second degree burn, third degree burn, and we will get through what are the first degree, second degree, and third degree. I have already arranged another slides for this presentation because this is a combination of all topics. But separately, I have already made slides for another presentation. So burns are tissue damage by heat, chemical radiation, or electricity. There are types of burns. First degree burn affect only the outermost layer and there is a mild pain. This you can say this is a superficial burn or first degree burn. There is a mild, okay, there is no blisters. If there are blisters then you can say second degree burn. This is a partial thickness or second degree burn, and another is the third degree and full thickness burn in which underlying tissues are also involved. You can say subcut tissues, and there is a mild pain because nerves are also compromised. So treatment for first degree burn is a cool compress, aloe vera and over the counter pain relief. Second degree, keep clean, apply antibiotic with sterile dressing, and third degree burn requires the skin grafting and seek emergency medical care. Okay. So there are the cons and clauses. Cons and clauses are because of the repeated pressure or frictions on a sole on a palm of the hand. So they are most commonly occurs on the sole because of the repetitive frictions. You can see there are the cracked heels and these are the claws and these are the cones. Cones are circular. So there are some symptoms: thick rough patches of skin, hardened or raised bumps, and tenderness or pain in affected area. area. So treatment, we can use a pumice stone to remove the dead skin cells because there is a accumulation of the dead skin cells. Moisturizer and use the properly footwears and protective padding foot and orthotic inserts to reduce the pressure on affected area. So another is the allergies and skin reactions which are most commonly occur because of using antibiotics and because of pollen, chemical and some medications. Certain medications can cause the allergy. There are certain signs of the allergy. There is a redness, itching, swelling, hives and dry patches. So immune system response causing skin irritation or rashes are called allergy. Common allergens are pollen, pet danders, certain foods, chemicals and medication. Symptoms include redness, itching, swelling, hives and dry patches. And treatment include antihistaminic and corticosteroid creams, avoid allergens and hydrate and soothing creams, and anaphylactic to prevent from the severe reaction which is an anaphylactic reaction or anaphylactic shock. You can use a medical interventions. So these are all symptoms of the allergy and skin reaction. Then there is a prevention and care tips. Follow a regular skin care and non-irritating use gentle non-irritating cleanser and moisturizer, apply sunscreens, hydration and avoid picking, squeezing or scratching affected areas. Use breathable fabrics and comfort footwears to avoid skin issues. And these are all about the prevention and care tips. So thank you so much for your time and we have end this lecture. I will come back soon. Okay. Allah Hafiz.